For many people, a cure isn't possible. You've heard all the commercials. Mesothelioma is an aggressive and deadly form of cancer.
But for one woman, she's hoping to be the exception, and she's crediting one local hospital with helping her to reach her goal. How about that? ABC2 is working for your health tonight. Here's Ashley James.
How are you?
I'm well. I feel so good.
Oh, good.
Kathy Ebright didn't have any symptoms when she went in for her yearly CAT scan for a pre-existing condition.
My vascular doctor notified my family doctor that he saw 3 little nodules, and he thought perhaps, it would need a little checking out.
A follow-up test would confirm it was cancer. November of 2015, Kathy was diagnosed with mesothelioma, a rare cancer almost always caused by exposure to asbestos.
What we've learned, it probably had to do with my dad working. He worked at Harrisburg Steel, and the steel mill was full of mesothelioma, asbestos everywhere, and they feel that's how I got. They are like 90% sure that that's probably where I got exposed.
Being from the small town of Richfield, Pennsylvania, Kathy's local hospital wasn't equipped to handle her case, so she was sent here to the University of Maryland's Marlene and Stuart Greenebaum Comprehensive Cancer Center, and that's where she met Dr. Joseph Friedberg.
He explained everything. I found he was not only looking out for me, but he understood that my family means a lot to me, and he really, I feel, was just wonderful.
Dr. Friedberg, professor of surgery at the University of Maryland School of Medicine and head of thoracic surgery at the University of Maryland Medical Center, says the extra time with patients is important because mesothelioma is rare, aggressive, and different than other cancers.
You can't cure anyone with surgery alone with mesothelioma because the cancer coats the entire lining of the chest cavity. The standard of care treatment for this remains a combination chemotherapy, believe it or not, that was established in 2003 and hasn't changed, at least in this country. So it's 2 drugs that are combined, and that it typically extends life several months.
Kathy wanted to get the ball rolling with her treatment, scheduling surgery 2 months after her diagnosis.
In her case, we were able to offer her this lung-sparing surgery. The simplest explanation is we take out the cancer and leave all the normal stuff.
Besides the surgery, Kathy's treatment also included chemotherapy.
That was a little rough.
Kathy is starting to feel more like herself again. She knows how serious this disease is, but with the support of her family and doctors, she's staying positive.
We're well aware that there is no cure for mesothelioma, but he's also told me that there's always that exception to the rule, and I intend to be that exception, so.
Dr. Friedberg says the survival rate for mesothelioma is typically a year from the time of diagnosis. He says the most common presenting symptoms are shortness of breath, pain, and feeling full quickly. For ABC2 News, I'm Ashley James.